USMLE Step 1 Sample Test Questions. Block 1. Items 1 through 46. A 25-year-old woman is brought to the emergency department 1 hour after she fainted. She has had mild intermittent vaginal bleeding, sometimes associated with lower abdominal pain, during the past 3 days. She has had severe cramping pain in the right lower abdomen for 12 hours. She has not had a menstrual period for 3 months. Previously, menses occurred at regular 28-day intervals. Abdominal examination shows mild tenderness to palpation in the right lower quadrant. Bimanual pelvic examination shows a tender, walnut-sized mass in the right parametrium. Which of the following is the most likely diagnosis? A. Appendicitis. B. Cancer of the ovary. C. Ectopic pregnancy. D. Endometriosis. E. Ovarian cyst. Or F. Placenta previa. The answer is C. Ectopic pregnancy. Acute abdominal pain in a fertile woman is very frequently going to be an ectopic question. Another fact to keep in mind is that the most common cause of secondary amenorrhea is pregnancy. 2. A 12-year-old girl with a 1-year history of systemic lupus erythematosus is brought to the physician for a routine follow-up examination. During the past year, she has done well with the exception of occasional mild frontal headaches, fatigue, and arthralgias. The results of regular laboratory evaluations have been stable. She has missed 20 days of school in the past 4 months. Her parents expressed concern that sending her to school might cause her to be exposed to children with contagious diseases that might exacerbate their daughter's condition. The girl tells the physician that she misses seeing her many friends at school. Passive motion of the elbows, wrists, and knees produces mild discomfort. Physical examination shows no other abnormalities. Which of the following is the most likely cause of this patient's excessive school absences? A. Lupus arthritis. B. Lupus cerebritis. C. Malingering. D. School phobia. Or E. Vulnerable child syndrome. The answer is E. Vulnerable child syndrome. Parents can be overly protective of their children with chronic diseases such as diabetes, lupus, etc. This child doesn't have SCID, so going to school isn't going to kill them. The child is in overall reasonable health with only mild symptoms. Vulnerable child syndrome is characterized by unreasonable parental anxiety. 3. A 4-year-old boy has delayed motor development and chorioathetosis. He had normal development at birth. He chews his fingers and lips, which has resulted in tissue loss. He has arthritis. Serum and urine uric acid concentrations are increased. Which of the following abnormalities is the most likely cause of these findings? A. Adenine phosphoribosyltransferase transferase deficiency. B. Hypoxanthine guanine phosphoribosyltransferase transferase deficiency. C. Increased cellular turnover of nucleic acids. D. Increased conversion of hypoxanthine to inosine monophosphate. Or E. Phosphoribosyl pyrophosphate synthetase deficiency. The answer is B. Hypoxanthine guanine phosphoribosyltransferase transferase deficiency, or HGPRT deficiency. HGPRT deficiency results in high uric acid. Self-mutilating behavior, example bad finger biting, is one of the more specific clinical features of this syndrome. 4. A 42-year-old woman comes to the physician for a routine examination. She says that she has felt well except for occasional episodes of constipation, abdominal discomfort, and mild fatigue. She was treated for a renal calculus 10 years ago and was told she had a lazy gallbladder. Her pulse is 82 per minute and blood pressure is 150 over 80 millimeters mercury. Physical examination shows no other abnormalities. Laboratory studies show erythrocyte count of 3 million per millimeter cubed, serum potassium of 4.5, chloride of 107, calcium 12, phosphorus 2.2, alkaline phosphatase 95. The most likely cause of this patient's condition is a small, well-defined nodule in which of the following locations? A. Adrenal gland. B. Anterior pituitary gland. C. Gallbladder. D. Kidney. E. Parathyroid gland. Or F. Thymus. The answer is E. Parathyroid gland. Functional parathyroid adenomas can cause elevated parathyroid hormone, or PTH, which results in hypercalcemia and hypophosphatemia. Hypercalcemia is characterized by the rhyming symptoms of stones, such as renal or biliary, bones, including bone pain to osteitis fibrosa cystica, groans, including abdominal pain and nausea and vomiting, thrones, including polyuria and constipation, and psychiatric overtones from depression to coma. 5. A 4-year-old girl has a sudden onset of abdominal pain and vomiting. She has a mass in the right lower quadrant and hyperactive bowel sounds. A segment of resected bowel is shown in the photograph. Which of the following is the most likely diagnosis? A. Appendicitis. B. Intussusception. C. Meckle diverticulum. D. Necrotizing enterocolitis. Or E. Strangulated hernia. The answer is B. Intussusception. The pathology specimen image shows a tube inside of a tube, or more specifically, bowel within bowel. This is intussusception, which has a classic history of sudden onset colicky pain, a palpable mass, and current jelly stools. On the other hand, a right lower quadrant lesion that causes pain and hematochezia, particularly in a child, would lead you to think of Meckel's diverticulum, often remembered by the rule of twos. 6. A 12-year-old girl with sickle cell disease has pain in her right arm. An X-ray of the right upper extremity shows bony lesions consistent with osteomyelitis. Which of the following is the most likely causal organism? A. Clostridium septicum. B. Enterococcus faecalis. C. Listeria monocytogenes. D. Proteus mirabilis. E. Pseudomonas aeruginosa. F. Salmonella enteritidis. Or G. Serratia marcescens. The answer is F. Salmonella enteritidis. While Staph aureus is the most common cause of hematogenous osteomyelitis in children, Salmonella is the most frequent cause for patients with sickle cell anemia. This is a favorite test question for USMLE. 7. A 3-year-old boy is brought to the physician because of fever, headache, and sores on his back and left shoulder for 1 day. His temperature is 37.8 degrees Celsius or 100 degrees Fahrenheit. Physical examination shows vesicles over the back and left shoulder as in the photograph shown. Treatment with aspirin is contraindicated in this patient because of an epidemiologic association with a syndrome that includes which of the following adverse effects? A. Bronchoconstriction. B. Disseminated intravascular coagulation. C. Gastric irritation. D. Hepatomegaly. Or E. Immunosuppression. The answer is D. Hepatomegaly. Reye syndrome is the reason why children don't receive aspirin, except of course to treat Kawasaki's disease. Reye syndrome is characterized by vomiting followed by liver damage, including hepatic steatosis and hepatomegaly, and encephalopathy beginning with irritability and aggressive behavior and potentially progressing to coma. 8. A 62-year-old woman comes to the physician because of low back pain for 1 week. Menopause occurred 10 years ago. Physical examination shows localized tenderness over the lumbar spine after movement. X-rays of the spine show a compression fracture of L1 to L2. A DEXA scan shows decreased bone mineral density. Serum calcium and phosphorus concentrations and serum alkaline phosphatase activity are within the reference ranges. A bisphosphonate drug is prescribed. The expected beneficial effect of this drug is most likely due to which of the following actions? A. Decreased insulin-like growth factor 1 concentration. B. Decreased osteoclast activity. C. Decreased osteoprotegerin production. D. Increased 1,25-dihydroxycholecalciferol concentration. E. Increased osteoblast activity. Or F. Increased receptor activator of NF-kappa beta ligand or RANK-L production. The answer is B. Decreased osteoclast activity. Bisphosphonates work by decreasing osteoclast activity, thereby reducing bone resorption. Choice F, increased RANK-L production, is the opposite of how estrogen therapy works. RANK-L is found on osteoblasts, and its activation triggers osteoclasts and stimulates bone resorption. 9. Hospital discharge of a 75-year-old man is delayed due to unavailability of a bed in a nursing home. He is bedridden and unable to attend to his personal needs. During a 3-day period, his pulse increases from 82 per minute to 125 per minute, and blood pressure decreases from 124/72 to 100/55. Laboratory values include hemoglobin on day 1 of a 16.4, day 3, 18.4, serum urea nitrogen, day 1, 18, day 3, 56, glucose, day 1, 100, day 3, 89, sodium, day 1, 135, day 3, 151, creatinine, day 1, 1.1, and day 3, 1.2. Which of the following is the most likely diagnosis? A. Acute renal failure. B. Dehydration. C. Diabetic ketoacidosis. D. Gastrointestinal hemorrhage. Or E. Syndrome of inappropriate ADH. The answer is B. Dehydration. Azotemia, hemoconcentration, and hypotension/tachycardia are all results of dehydration. This may lead to acute renal failure if allowed to continue, but this diagnosis requires a change in creatinine of 0.3. 10. A 76-year-old man with a history of prostatic hypertrophy has the recent onset of increased difficulty urinating. Symptoms began shortly after he started taking a nasal decongestant orally for cold symptoms. Which of the following types of receptors is most likely to be involved in these adverse effects? A. Alpha-1 adrenergic. B. Beta-2 adrenergic. C. Ganglionic nicotinic. D. Nicotinic receptor at the neuromuscular junction. Or E. Serotoninergic. The answer is A. Alpha-1 adrenergic. Phenylephrine is an alpha-agonist nasal spray and oral medication that often shows up on exams. Oxymetazoline, or Afrin, is a similar alpha-agonist nasal spray. Pseudoephedrine is another decongestant with a similar mechanism of action that's less common now that it's a federally monitored component of methamphetamine production. Topical alpha-agonist decongestants are physically addictive and can cause miserable rebound congestions called rhinitis medicamentosa. Systemic formulations can cause hypertension and worsen prostate problems by causing prostatic smooth muscle constriction. Just remember that tamsulosin, or Flomax, is an alpha-5A antagonist which relaxes prostate muscle. 11. A 15-year-old girl is brought to the physician because of a 3-week history of excessive thirst and voiding excessive amounts of urine. She shows no signs of kidney damage and she is not taking any medications. Physical examination shows no abnormalities. She undergoes an 8-hour water deprivation test. She is also given 5 units of ADH or vasopressin subcutaneously. Under both conditions, she continues to produce large volumes of dilute urine. Her symptoms are most likely due to a relative lack of which of the following proteins from the apical membranes of collecting duct epithelial cells? A. Aquaporin. B. Epithelial sodium channel. C. NAK ATPase. D. NAK2Cl cotransporter. Or E. Urea transporter. The answer is A. Aquaporin. The patient has nephrogenic diabetes insipidus, in which large volume dilute urine production occurs. This cannot be reversed with the administration of exogenous vasopressin. Aquaporins are the water channels that allow for the reabsorption of free water from the collecting ducts and the production of concentrated urine. 12. A placebo-controlled clinical trial is conducted to assess whether a new antihypertensive drug is more effective than standard therapy. A total of 5,000 patients with essential hypertension are enrolled and randomly assigned to one of two groups. 2,500 patients receive the new drug, and 2,500 patients receive placebo. If the alpha is set at 0.01 instead of 0.05, which of the following is the most likely result? A. Significant findings can be reported with greater confidence. B. The study will have more power. C. There is a decreased likelihood of a type 2 error. D. There is an increased likelihood of statistically significant findings. Or E. There is an increased likelihood of a type 1 error. The answer is A. Significant findings can be reported with greater confidence. The p-value corresponds to the likelihood of a type 1 error or a false positive. A lower p-value means a lower acceptable likelihood of obtaining the same results by chance, and thus significant results can be reported more confidently. For example, a 1% false positive rate instead of a 5% rate in this case. 13. A sexually active 23-year-old man with multiple sex partners has dysuria and a yellow urethral exudate. Gram stain of the exudate shows numerous neutrophils, many that contain intracellular gram-negative diplococci. He has had 3 similar episodes of urethritis over the past 2 years. Which of the following properties of the infecting organism best explains the reinfection? A. Antigenic variation. B. Catalase. C. Inhibition of B lymphocyte function. D. Inhibition of T lymphocyte function. Or E. Polysaccharide capsule. The answer is A. Antigenic variation. Gonorrhoeae can change its pilus, which is responsible for adhesion to host cells and is the main antigen to which the host mounts an immune response. Neisseria gonorrhoeae is able to switch out different pilin genes, and for this reason, prior infection does not confer long-lasting immunity. 14. A 68-year-old woman has a sudden onset of weakness in her right arm and leg. She can speak, but her words are not enunciated clearly. Neurologic examination 6 weeks later shows an extensor plantar reflex on the right. When she is asked to protrude her tongue, it deviates to the left, and the muscle in the left side of the tongue shows considerable atrophy. Which of the following labeled areas in the transverse sections of the brainstem is most likely damaged? A, B, C, D, or E? The answer is B. Crossed findings mean a brainstem lesion. Left or ipsilateral tongue, right-sided or contralateral weakness means the exiting left hypoglossal nerve has been affected within the left medulla. The segment labeled B in this image is the pyramid where the corticospinal tract runs to control muscles prior to the decussation. This is known as medial medullary syndrome. 15. A 33-year-old woman comes to the physician because of a 2-day history of mild nausea, increased urinary urgency and frequency, and constipation. She also has had a 4.5 kg or 10-pound weight loss during the past 2 weeks and a 3-week history of vaginal bleeding. Pelvic examination shows a nodular cervix with an irregular, friable posterior lip and a rock-hard, irregular, immobile pelvic mass that extends across the pelvis. Examination of biopsy specimens from the cervix and anterior wall of the vagina show well-differentiated keratinizing squamous cell carcinoma. Which of the following best describes the pathogenesis of this patient's disease? A. Inactivation of cellular p53. B. Insertion of viral promoters adjacent to cellular growth factor genes. C. Specialized transduction. D. Transactivation of cellular growth factor genes by TACs. Or E. Translocation of c-MYC to an Ig gene promoter. The answer is A. Inactivation of cellular p53. p53 is the quintessential tumor suppressor as it activates apoptosis. Carcinogenesis of HPV is caused by insertion of the virus into the host DNA and production of a protein which binds with an essential p53 substrate, functionally inactivating the p53 and its apoptotic cascade. D, or transactivation of cellular growth factors genes by TACs, is how HIV and HTLV cause cancer. E, or translocation of c-MYC to an Ig gene promoter, is what causes Burkitt's lymphoma. 16. A 22-year-old man develops delusions, flattening of affect, catatonic behavior, hallucinations, and aphasia. Which of the following symptoms would be more likely to improve if this patient were treated with clozapine rather than with haloperidol? A. Affective flattening and aphasia. B. Affective flattening and hallucinations. C. Aphasia and delusions. D. Catatonia and delusions. Or E. Hallucinations and catatonia. The answer is A. Affective flattening and aphasia. Atypical antipsychotics such as clozapine and quetiapine are more likely to improve negative symptoms including affective flattening, anhedonia, avolition, and aphasia when compared to typical antipsychotics such as haloperidol. However, they are not more effective at treating positive symptoms such as hallucinations or delusions. This is a very commonly tested fact. 17. After infection with measles virus, a 6-year-old boy produces antibodies to all 8 viral proteins. The next year, he is again exposed to measles virus. Antibodies to which of the following viral proteins are most likely to be protective? A. Hemagglutinin. B. Matrix. C. Non-structural. D. Nucleocapsid. E. Polymerase. The answer is A. Hemagglutinin. The antibodies to surface antigens are protective. Hemagglutinin is a surface antigen that is responsible for clumping RBCs in vitro. 18. A 25-year-old woman comes to the physician because of a 10-year history of frequent occurrences of fever blisters. Physical examination shows perioral vesicles. Microscopic examination of culture of scrapings from 3 vesicles shows herpes simplex virus 1. Which of the following patterns in the figure shown was most likely observed when the viral DNA from the cultures was examined by restriction enzyme analysis on polyacrylamide gels? A, B, C, or D? The answer is A. All the vesicles contain the same viral infection, so all should have the same appearance on gel. This is represented in answer choice A. Choice D is what a gel looks like without using a restriction enzyme digest, i.e., no discrete bands of specific weights. 19. A 52-year-old woman comes to the physician because of a 2-day history of fever and left flank pain. She has been treated for multiple episodes of pyelonephritis during the past 3 years. Her temperature is 37.8 degrees Celsius or 100.1 degrees Fahrenheit. Physical examination shows left flank tenderness. Urine analysis shows 12 to 18 white blood cells per high power field, with occasional lymphocytes and mononuclear cells with features of macrophages. Cultures of urine grow 80,000 colonies per milliliter of Proteus mirabilis. An X-ray of the abdomen shows a 3 cm mass in the lower pole of the left kidney. Gross examination of the mass after it has been resected shows that it is yellow, 3.2 cm in diameter, and centrally but not marginally necrotic. Histologic examination of the mass shows a predominance of epithelioid cells with partially clear and granular to foamy cytoplasm. Nuclei are eccentric, normochromic, symmetric, and without significant pleomorphism. Scattered lymphocytes and plasma cells are intermixed. Which of the following is the most likely diagnosis? A. Acute pyelonephritis. B. Malakoplakia. C. Renal cell carcinoma, clear cell type, intermediate grade. D. Renal cell carcinoma, granular cell type. Or E. Xanthogranulomatous pyelonephritis. The answer is E. Xanthogranulomatous pyelonephritis. Xanthogranulomatous pyelonephritis, or XGP, is a rare form of chronic pyelonephritis, especially associated with Proteus infection. Tumor-like growth, upper urinary tract infection, and most importantly, lipid-laden foamy macrophages make this neither acute pyelo nor cancer. B. Malakoplakia causes GU papules and ulcers, typically of the bladder. 20. A 35-year-old woman with a bicuspid aortic valve comes to the physician because of a 1-week history of a swollen, painful left knee. She has had occasional fever and progressive fatigue during the past 4 months. Her temperature is 38.2 degrees Celsius or 100.8 degrees Fahrenheit. Physical examination shows a tender left knee with an effusion. A grade 2 out of 6 systolic murmur is heard. Echocardiography shows a vegetation on the aortic valve. Analysis of synovial fluid aspirated from the left knee shows many segmented neutrophils. A gram stain shows no organisms, and culture is negative. Microscopic examination of the urine shows RBCs and RBC casts, but culture of the urine grows no organisms. 4 blood cultures grow an alpha hemolytic streptococcus. Which of the following is the most likely cause of the joint and renal disease? A. Autoimmune response triggered by a bacterial antigen. B. Deposition of antigen-antibody complexes. C. IgA nephropathy. D. Neutrophil response to replicating bacteria. Or E. Type 4 or delayed hypersensitivity to a bacterial antigen. The answer is B. Deposition of antigen-antibody complexes. Post-streptococcal glomerulonephritis is caused by the deposition of circulating immune complexes. This is a type 3 hypersensitivity and a test favorite. 21. An otherwise healthy 45-year-old man comes to the physician because of a 3-week history of progressive epigastric heartburn and a 4.5 kg or 10-pound weight loss. The pain tends to be more severe at night and occurs 1 to 3 hours after meals during the day. He has had similar episodes with lesser intensity during the past year. Abdominal examination shows tenderness to deep palpation. Test of the stool for occult blood is positive. Endoscopy shows a bleeding 3 cm ulcer in the antrum of the stomach. A photomicrograph of Steiner silver stain tissue at 400x from a biopsy of the gastric mucosa adjacent to the ulcer is shown. Which of the following processes is most likely to be involved? A. Elaboration of proteases and urease with local tissue destruction. B. Hyperacidity and gastric ulcer development. C. ingestion of preformed toxins in contaminated well water, or D, spirochete invasion of gastric cells? The answer is A, elaboration of proteases and urease with local tissue destruction. This patient has a peptic ulcer, which we know is caused predominantly by H. pylori infection. H. pylori produces proteases and particularly urease, which allow it to decrease the pH of its local environment by cleaving urea into ammonia, which is toxic to gastric mucosa. The picture demonstrates H. pylori, which is evident with silver staining. A 28-year-old man comes to the physician because of a 1-year history of pain with urination that has increased in severity during the past month. He also has had episodes of blood in his urine during the past 5 years. He lived in sub-Saharan Africa until he came to the USA 6 months ago for graduate school. His temperature is 38 degrees Celsius or 100.4 degrees Fahrenheit. Pulse is 80 per minute, respirations are 16 per minute, and blood pressure is 110/84. Physical examination shows suprapubic tenderness. Laboratory studies show hemoglobin 12.3, hematocrit 37, leukocyte count 13,400, segmented neutrophils 65%, bands 5%, eosinophils 5%, lymphocytes 22%, monocytes 3%. Serum urea nitrogen 75, creatinine 3.8. Urine blood 3+, RBCs 200, white blood cells 100, red blood cell casts absent, white blood cell casts absent. Imaging studies show bilateral hydroureter and hydronephrosis and foci of calcification in the region of the bladder. A biopsy specimen of the bladder shows marked chronic inflammation with fibrosis and scattered granulomas. Which of the following best explains the biopsy findings? A. Exposure to a chemical toxin. B. Interstitial cystitis. C. Malakoplakia. D. Schistosomiasis. Or E. Vesicoureteral reflex. The answer is D. Schistosomiasis. Schistosoma is a parasitic worm that is particularly endemic in Africa and is most associated with chronic cystitis. Calcifications of the bladder wall are essentially pathognomonic. Chronic infection is associated with an increased risk of squamous cell carcinoma of the bladder, as opposed to the usual urothelial or transitional cell. A 4-year-old boy is brought to the physician because of slow growth during the past year. He has had recurrent urinary tract infections since the age of 1 year. He is at the 10th percentile for height and 25th percentile for weight. Physical examination shows pallor. Laboratory studies show a normochromic, normocytic anemia, and increased serum concentrations of urea nitrogen and creatinine. Urinalysis shows a low specific gravity. Which of the following sets of additional serum findings is most likely in this patient? A. Increased calcium, increased organic phosphorus, increased 1,25-dihydroxycholecalciferol, and decreased erythropoietin. B. Increased calcium, increased inorganic phosphorus, decreased 1,25-dihydroxycholecalciferol, and decreased erythropoietin. C. Increased calcium, decreased inorganic phosphorus, decreased 1,25-dihydroxycholecalciferol, and increased erythropoietin. D. Decreased calcium, increased inorganic phosphorus, increased 1,25-dihydroxycholecalciferol, and decreased erythropoietin. E. Decreased calcium, increased inorganic phosphorus, decreased 1,25-dihydroxycholecalciferol, and decreased erythropoietin. Or F. Decreased calcium, decreased inorganic phosphorus, increased 1,25-dihydroxycholecalciferol, and increased erythropoietin. The answer is E. Serum findings of decreased calcium, decreased inorganic phosphorus, increased 1,25-dihydroxycholecalciferol, and increased erythropoietin. This patient has chronic kidney disease as indicated by elevated serum creatinine and BUN and evidence of anemia of chronic disease that is normochromic and normocytic. Poorly functioning kidneys do not hydroxylate 25-dihydroxycholecalciferol to 1,25-dihydroxycholecalciferol well, nor do they produce adequate erythropoietin, hence the CKD-related anemia. Patients with CKD development thus develop secondary hyperparathyroidism due to derangements in phosphate excretion and inadequate vitamin D activation, resulting in hypocalcemia. Thus, we should expect to see low calcium, high phosphorus, low 125 vitamin D, and low EPO, which is answer E. A 38-year-old man who recently immigrated to the USA comes to the physician because of a 1-month history of cough and a 4.5 kilogram or 10-pound weight loss. Physical examination shows no abnormalities. A chest x-ray shows a right upper lobe infiltrate. 1 of 3 sputum samples is positive for acid-fast bacilli. Treatment with isoniazid, rifampin, ethambutol, and pyrazinamide is started. Which of the following should be added to the medication regimen to prevent neurologic toxicity in this patient? A. Folic acid. B. Nicotinic acid. C. Vitamin B6 or pyridoxine. D. Vitamin B12 or cyanocobalamin. Or E. Vitamin C. The answer is C. Vitamin B6 or pyridoxine. Isoniazid can cause peripheral neuropathy due to its depletion of pyridoxine or vitamin B6. B6 supplementation is therefore preventative. Isoniazid can also cause drug-induced lupus, which is another test favorite, and sometimes even severe liver disease. 25. A 12-year-old girl is brought to the emergency department by her parents because of a 3-day history of fever and a 12-hour history of lethargy. Her parents say that she has been sleeping most of the day and has been unresponsive when awake. Her temperature is 39.2 degrees Celsius or 102.6 degrees Fahrenheit. Physical examination shows numerous petechial hemorrhages and nuchal rigidity. A lumbar puncture yields cloudy cerebrospinal fluid that clots in the collection tube. Microscopic examination of the CSF shows numerous segmented neutrophils, and a gram stain shows gram-negative diplococci. Which of the following is the most likely causal organism? A. Haemophilus influenza. B. Mycoplasma pneumoniae. C. Neisseria meningitidis. D. Salmonella typhi. Or E. Streptococcus pneumoniae. The answer is C. Neisseria meningitidis. The patient has fever, lethargy, nuchal rigidity, and petechial hemorrhages, along with cloudy CSF fluid with numerous segmented neutrophils. The meningitis diagnosis is a giveaway. Your job is to know 2 things. 1. The common pathologic organisms in different age groups, and 2. That Neisseria is a gram-negative diplococcus. 26. A technician wants to determine whether cytomegalovirus or CMV DNA is present in the blood of a bone marrow transplant recipient. DNA purified from the leukocytes of the patient is reacted in a mixture containing oligonucleotides specific for CMV DNA, thermostable DNA polymerase, and nucleotides. Repetitive cycles of heating and cooling are performed, and the reaction product is detected by gel electrophoresis. The technician most likely used which of the following laboratory procedures on this patient's blood? A. Northern blotting. B. Polymerase chain reaction. C. Reverse transcription. D. Southern blotting, or E. Western blotting? The answer is B. Polymerase chain reaction. PCR is used to amplify tiny fragments of DNA in order to detect their presence. The question is a description of the process. D, or southern blotting, is used to detect a specific DNA sequence within a DNA sample. 27. A 6-year-old boy from rural Mississippi is brought to the physician by his mother because of a 6-month history of lethargy. He also has had a 4-kilogram or 9-pound weight loss during this period. The mother says her son used to be active, often playing outside without wearing his shoes. The patient is at the 10th percentile for height and 12th percentile for weight. He appears pale. Physical examination shows pale oral mucosa. Laboratory studies show iron deficiency anemia. Microscopic examination of the stool shows thin-shelled ova. Which of the following is the most appropriate pharmacotherapy for this patient? A. Doxycycline. B. Ivermectin. C. Mebendazole. D. Mefloquine. Or E. Trimethoprim sulfamethoxazole. The answer is C. Mebendazole. Hookworm infection can cause intestinal irritation leading to chronic GI blood loss and iron deficiency anemia. The patient is an otherwise healthy boy who lives in rural Mississippi who often plays outdoors without wearing shoes, likely in sand, dirt, or mud, which is a potential risk factor for getting hookworm. Treatment is mebendazole. Albendazole would also be an acceptable therapy. These are your go-to antihelminthics. 28. A 17-year-old girl has never had a menstrual period. Physical examination shows a normal female body habitus, normal breast development, and normal appearing external genitalia. She has no axillary or pubic hair. The patient refuses to have a pelvic or rectal exam. Which of the following is the most likely explanation for the clinical presentation? A. Androgen insensitivity. B. Congenital adrenal hyperplasia. C. Ectodermal dysplasia. D. A psychiatric disorder. Or E. A sex chromosome mosaicism. The answer is A. Androgen insensitivity. Androgen insensitivity is caused by a defective androgen receptor. DHT, or dihydrotestosterone, is responsible for creating male genitalia during fetal sexual development. The default human gender is female, so a genetically male patient with complete androgen insensitivity is externally phenotypically female. A lack of response to adrenal androgens prevents hair formation during puberty or adrenarche. 29. Warfarin is administered to a 56-year-old man following placement of a prosthetic cardiac valve. The warfarin dosage is adjusted to maintain an INR of 2.5. Subsequently, trimethoprim sulfamethoxazole therapy is begun for a recurring urinary tract infection. In addition to monitoring prothrombin time, which of the following actions should the physician take to maintain adequate anticoagulation? A. Begin therapy with vitamin K. B. Increase the dosage of warfarin. C. Make no alterations in the dosage of warfarin. D. Decrease the dosage of warfarin. Or E. Stop the warfarin and change to low-dose aspirin. The answer is D. Decrease the dosage of warfarin. Warfarin is metabolized by the cytochrome P450 system. Trimethoprim sulfamethoxazole, or Bactrim, is a CYP450 inhibitor and can thus prolong the action of warfarin, leading to potentially dire consequences. Be sure to review the list of drugs that induce and inhibit CYP450. 30. A 40-year-old woman comes to the physician because of a 6-month history of increased facial hair growth. Her last menstrual period was 4 months ago. She is 165 centimeters or 5 feet 5 inches tall and weighs 70 kilograms or 154 pounds. BMI is 26. Her pulse is 80 per minute and blood pressure is 130/82. Physical examination shows temporal balding and coarse dark hair on the upper lip and chin. Pelvic examination shows clitoral enlargement. Her serum testosterone concentration is increased. Serum concentrations of androstenedione, dehydroepiandrosterone, and urinary 17-ketosteroids are within the reference ranges. Ultrasonography of the pelvis shows a 12-centimeter ovarian mass. Which of the following best describes this mass? A. Granulosa tumor. B. Ovarian carcinoid. C. Sertoli-Leydig tumor. D. Teratoma. Or E. Thecoma. The answer is C. Sertoli-Leydig tumor. Leydig cells make testosterone. Leydig cell tumors aren't always physiologically active, but those that are can cause masculinization. A. Granulosa cell tumors, on the other hand, sometimes produce estrogen. B. Ovarian carcinoid is highly unlikely to be tested, but would likely present with a classic carcinoid syndrome. D. Teratomas have components derived from more than one germ layer, often including fat, hair, teeth, bone, etc. (31) A 7-month-old infant is brought to the physician's office because of poor weight gain despite large food intake. He has had 2 episodes of pneumonia and has frequent bulky stools. He coughs frequently. X-rays of the lungs show increased markings and hyperinflation. Trypsin is absent in a fresh stool sample and the fat content is increased. Which of the following is a most likely cause of this infant's disorder? A. Autoimmune disorder. B. Defective ion transport at epithelial surfaces. C. Disaccharidase deficiency. D. Inability to synthesize apolipoprotein B. Or E. Villus atrophy of the jejunum. The answer is B. Defective ion transport at epithelial surfaces. This patient has cystic fibrosis. The combination of respiratory and GI issues is classic and caused by ineffective chloride transport and consequently thick exocrine secretions, which clog up the airways and the pancreatic ducts. (32) A 50-year-old man has headache, vertigo, and generalized pruritus. He has a recent onset of angina pectoris. His hematocrit is 65%, leukocyte count is 12,000, and erythrocyte mass is increased. Erythropoietin concentration is decreased. Which of the following is the most likely diagnosis? A. Glucose 6-phosphate dehydrogenase deficiency. B. Hemochromatosis. C. Immune thrombocytopenic purpura. D. Pernicious anemia. E. Polycythemia vera. F. Pyruvate kinase deficiency. Or G. Secondary polycythemia. The answer is E. Polycythemia vera. Polycythemia vera is a red blood cell cancer. Symptoms are related to hyperviscosity of the increased hematocrit. A classic symptom of polycythemia vera is pruritus, typically with exposure to hot water, example following a hot shower. Super high hematocrits are indicative. Low EPO means that the body is responding appropriately by trying to tone down RBC production, which continues autonomously in polycythemia vera. JAK2 mutations are commonly associated with PV and are a test favorite. The classic treatment is serial phlebotomy to reduce RBC mass. 33. A new blood test to detect prostate cancer is evaluated in 300 male volunteers. A needle biopsy of the prostate gland is done on all men with serum prostate-specific antigen concentrations greater than 5 nanograms per milliliter. 100 men undergo biopsy procedures. 90 are found to have prostate cancer, and 5 are found to have chronic prostatitis. Which of the following is necessary to calculate the sensitivity of this test? A. Incidence of chronic prostatitis in the general population. B. Number of men with test results greater than 5 nanograms per milliliter and a normal biopsy specimen. C. Prevalence of chronic prostatitis in the general population. Or D. Prostate biopsies of men with test results equal to or below 5 nanograms per milliliter. The answer is D. Prostate biopsies of men with test results equal to or below 5 nanograms per milliliter. Sensitivity rules things out and is calculated by dividing true positives by the sum of true positives and false negatives. So in order to calculate the sensitivity of this test, we need the true positives, the 90 with cancer, and the false negatives, the patients who actually do have prostate cancer but for whom the test is negative. This population is answer D. Prostate biopsies of men with test results equal to or below 5 nanograms per milliliter. 34. A 47-year-old man comes to the physician because of a 1-week history of temperatures to 38.3 degrees Celsius or 101 degrees Fahrenheit and occasional vomiting. He also has a 1-year history of joint and muscle pain in his calves and a 1-month history of intermittent diffuse abdominal pain. His temperature now is 37.2 degrees Celsius or 99 degrees Fahrenheit. Abdominal examination shows mild diffuse tenderness. There is no ascites. Test of the stool for occult blood is positive. Serum studies show mildly increased urea nitrogen and creatinine concentrations. Photomicrographs of a biopsy specimen of the mesentery are shown. Which of the following is the most likely diagnosis? A. Angiodysplasia. B. Mucocutaneous lymph node syndrome or Kawasaki disease. C. Polyarteritis nodosa. D. Takayasu arteritis. E. Thromboangiitis obliterans. Or F. Wegener's granulomatosis. The answer is C. Polyarteritis nodosa. Polyarteritis nodosa is the only answer that makes sense in explaining the diffuse constellation of symptoms in this question. It affects small and medium arteries, including those involving the skin, heart, kidneys, GI tract, etc. On imaging, a rosary sign of small aneurysms strung like beads on a rosary is sometimes mentioned. The biopsy image shows an inflamed artery or arteritis. Angiodysplasia, choice A, typically causes painless GI bleeding, like that seen in diverticulosis. B, Kawasaki disease, occurs in children with 5 days of fever, strawberry tongue, etc. D, Takayasu arteritis, involves big arteries like the aorta, carotids, and subclavians with classically diminished upper extremity pulses, hence pulseless disease. E, thromboangiitis obliterans is also known as Berger's disease, a vasculitis seen essentially exclusively in smokers that causes severe peripheral artery disease, legs much more so than hands. F, Wegener's, is typified by the combination of renal and lung and sinus findings in conjunction. The picture would show granulomas, and C. ANCA would likely be positive. 35. A 15-year-old girl comes to the physician because of a 3-month history of acne. Breast and pubic hair development began at the age of 12 years. Menarche occurred at the age of 14 years. Physical examination shows scattered open and closed comedones over the cheeks and forehead. Breast and pubic hair development are Tanner stage 5. Which of the following is the most likely underlying cause of this patient's acne? A. Decreased parasympathetic stimulation to the sebaceous glands. B. Increased estrogen stimulation of the sebaceous glands. C. Increased responsiveness of the sebaceous glands to follicle-stimulating hormone. D. Increased sympathetic stimulation to the sebaceous glands. Or E. Stimulation of the sebaceous glands by androgens. The answer is E. Stimulation of the sebaceous glands by androgens. Androgens stimulate sebaceous glands and cause acne. In girls, this is primarily due to adrenergic when DHEA/DHEAS androgens are produced by the adrenal gland in the zona reticularis. Boys can also blame testosterone from gonadal puberty or pubarchy. 36. A 6-year-old boy with glioblastoma has a recurrence of the tumor despite aggressive treatment. The physician discusses the patient's prognosis with his parents and recommends palliative care. The parents ask how they should talk with their son about his prognosis and possible death. The physician advises that the parents should be honest and follow the patient's lead during the conversation. This patient most likely has which of the following concepts of death? A. Being asleep. B. Being final. C. Being a long journey. D. Being a temporary separation from his parents. Or E. No understanding of death. The answer is B. Being final. 6-year-olds typically understand the finality of death. Infants have no understanding, whereas preschool-age children often think of deaths in reversible or metaphorical terms. 37. A 42-year-old man comes to the physician for a follow-up examination 1 week after he passed renal calculus. X-ray crystallographic analysis of the calculus showed calcium as a primary cation. Physical examination today shows no abnormalities. A 24-hour collection of urine shows increased calcium excretion. Which of the following is the most appropriate pharmacotherapy? A. Carbonic anhydrase inhibitor. B. NaCl symport inhibitor. C. NaK2Cl symport inhibitor. D. Osmotic diuretic. E. Renal epithelial sodium channel inhibitor. The answer is B. NaCl symport inhibitor. Thiazides, typically used as antihypertensives, also increase calcium resorption in the distal tubule and are therefore useful in preventing calcium oxalate stone formation in patients with hypercalciuria. Thiazides block the NaCl symporter as opposed to loop diuretics, which block the NaK2Cl triporter, and acetazolamide, which blocks carbonic anhydrase in the proximal tubule. 38. A 35-year-old man who works at a facility processing highly radioactive substances accidentally receives a high, whole-body dose of ionizing radiation estimated to be 1500 rads or 15 gray. He dies 1 week later. At autopsy, histologic examination of the skin shows scattered individual epidermal cells with shrunken, markedly eosinophilic cytoplasm and pycnotic, fragmented nuclei. These morphologic changes most likely indicate which of the following processes? A. Apoptosis. B. Coagulation necrosis. C. Liquefaction necrosis. D. Mutagenesis. Or E. Tumor initiation. The answer is A. Apoptosis. Pycnosis and nuclear fragmentation are part of the process of apoptosis. 39. A 52-year-old man comes to the emergency department because he has had vomiting, nausea, and abdominal pain for the past 12 hours. He says he attempted suicide 3 days ago by taking everything in the medicine cabinet. He was stuporous for approximately 12 hours after the overdose but felt better the following day. At this time, he has jaundice and pain in the right upper quadrant. Which of the following drugs is most likely to have caused the pain, vomiting, and jaundice? A. Acetaminophen. B. Aspirin. C. Cimetidine. D. Diphenhydramine. Or E. triazolam? The answer is A, acetaminophen. Acetaminophen, or Tylenol, can cause fulminant hepatic failure in overdose. This is a commonly tested concept. 40. A 45-year-old man comes to the physician because of a right shoulder pain that began after he chopped wood 2 days ago. Examination of the right upper extremity shows no obvious bone deformities or point tenderness. The pain is reproduced when the patient is asked to externally rotate the shoulder against resistance. There is no weakness. In addition to the teres minor, inflammation of which of the following tendons is most likely in this patient? A, infraspinatus. B, pectoralis. C, subscapularis. D, supraspinatus. Or E, trapezius. The answer is A, infraspinatus. The infraspinatus and teres minor are responsible for external rotation. Both the infraspinatus and supraspinatus muscles are innervated by the suprascapular nerve. 41. A 2-year-old girl is brought to the emergency department because of pain in her right forearm after a fall 1 hour ago. She has a history of fractures of the left femur and right tibia. Physical examination shows blue sclera. There is tenderness to palpation over the distal right radius. A mutation in which of the following genes is most likely cause of recurrent fractures in this patient? A, calcitonin. B, collagen type 1. C, 1-alpha hydroxylase. D, parathyroid hormone. Or E, vitamin D receptor. The answer is B, collagen type 1. Osteogenesis imperfecta is associated with blue sclera and lots of fractures even prenatally. It is caused by a defect in type 1 collagen. 42. A 55-year-old woman with small cell carcinoma of the lung is admitted to the hospital to undergo chemotherapy. 6 days after treatment is started, she develops a temperature of 38 degrees Celsius, or 100.4 degrees Fahrenheit. Physical examination shows no other abnormalities. Laboratory studies show a leukocyte count of 100 per millimeter cubed, with 5% segmented neutrophils and 95% lymphocytes. Which of the following is the most appropriate pharmacotherapy to increase this patient's leukocyte count? A, darbepoetin. B, dexamethasone. C, filgrastim. D, interferon alpha. E, interleukin 2. Or F, leucovorin. The answer is C, filgrastim. Filgrastim is a granulocyte colony stimulating factor, which is a type of drug used to increase white blood cell count in patients with leukopenia. F, leucovorin or folinic acid, sounds like it would also be right, but it is used to prevent bone marrow suppression in patients taking methotrexate. A, darbepoetin, like erythropoietin, is used to stimulate red blood cell production. 43. A 23-year-old man comes to the physician because of a 2-day history of sore throat. Current medications include an inhaled corticosteroid for asthma. His temperature is 37 degrees Celsius or 98.6 degrees Fahrenheit. A photograph of the tongue is shown. A KOH preparation of a scraping from one of the plaques shows budding yeast. Which of the following is the most appropriate pharmacotherapy for this patient? A, amphotericin B. B, caspofungin. C, fluconazole. D, flucytosine. E, itraconazole. F, nystatin, or G, voriconazole? The answer is F, nystatin. Nystatin mouthwash is a treatment of choice for oral candidiasis. It's topical, easy to use, and effective. For tongue thrush, the patient can swish and spit it out, therefore avoiding side effects. For pharyngeal or esophageal candidiasis, the patient can swish and swallow. Inhaled corticosteroids, particularly if used without an air chamber or spacer, can cause local immune suppression when contacting the oral mucosa, leading to thrush. 44. A full-term female newborn is examined shortly after birth. She appears to be small for gestational age, and she has excess skin on the nape of her neck and lymphedema of the hands and feet. Chromosomal analysis shows some cells with a normal 46XY karyotype and some cells with a 45X karyotype. Which of the following mechanisms best explains this cytogenic abnormality? A. Non-disjunction in mitosis. B. Reciprocal translocation. C. Robertsonian translocation. D. Skewed X inactivation. Or E. Uniparental disomy. The answer is A. Non-disjunction in mitosis. Lymphedema of the neck is also known as cystic hygroma. This, in combination with the 45X karyotype, is classic for Turner syndrome. Mosaic Turner syndrome and the mosaic trisomies result from non-disjunction during mitosis. In total monosomy or trisomies, the cause is non-disjunction during meiosis. Uniparental disomy is essentially only tested via the Prader-Willi and Angelman syndromes, which affect chromosome 15. 45. A 46-year-old woman receives a non-T lymphocyte depleted allogenic bone marrow transplant from a matched, unrelated donor. Immunosuppressive therapy with cyclosporine is started. 1 month later, she has fever. Cytolytic destruction of the skin, gastrointestinal tract, and liver is seen, with associated dermatitis, enteritis, and hepatitis. Which of the following best explains these findings? A. C3b deposition. B. Cytomegalovirus infection. C. Graft versus host disease. D. Tolerance induction. Or E. Type 1 or immediate hypersensitivity. The answer is C. Graft versus host disease. Graft versus host disease, or GVHD, is a rare medical complication following the receipt of transplanted tissue from a genetically different person. Immune cells, or white blood cells in the donated tissue, the graft, recognize the recipient, the host, as foreign. The transplanted immune cells then attack the host's body cells. Skin and GI lesions are especially common sites. Mucosal tissues are rapidly dividing and thus more prone to attack. 46. A 26-year-old man is brought to the emergency department by ambulance 30 minutes after being shot in the leg. He is unconscious and appears markedly pale. His pulse is 120 per minute, respirations are 16 per minute, and blood pressure is 80/60. Compared with a healthy adult, which of the following findings is most likely in this patient? A. Increased arterial baroreceptor firing rate, increased systemic vascular resistance, increased pulmonary vascular resistance, and systemic capillary fluid filtration. B. Increased arterial baroreceptor firing rate, decreased systemic vascular resistance, increased pulmonary vascular resistance, and systemic capillary fluid absorption. C. Increased arterial baroreceptor firing rate, decreased systemic vascular resistance, decreased pulmonary vascular resistance, and systemic capillary fluid filtration. D. Decreased arterial baroreceptor firing rate, increased systemic vascular resistance, increased pulmonary vascular resistance, and systemic capillary fluid absorption. E. Decreased arterial baroreceptor firing rate, increased systemic vascular resistance, decreased pulmonary vascular resistance, and systemic capillary fluid filtration. Or F. Decreased arterial baroreceptor firing rate, decreased systemic vascular resistance, decreased pulmonary vascular resistance, and systemic capillary fluid absorption. The answer is D. Decreased arterial baroreceptor firing rate, increased systemic vascular resistance, increased pulmonary vascular resistance, and systemic capillary fluid absorption. The baroreceptors are stretch receptors, i.e. the more fluid in the vessel, the more they fire. Thus, a patient with hemorrhagic shock will see a decrease in the baroreceptor firing rate. Activation of the renin-angiotensin-aldosterone system will result in increased vascular resistance or vasoconstriction in order to maintain blood pressure. Capillaries, such as those in the kidney, will be primed for resorption and not filtration. The body does not want to produce dilute urine when it is dehydrated. Likewise, systemic capillaries will prefer to hold on to plasma and not let it leak into the interstitium, or third space. Thank you very much for listening. Please leave comments and suggestions. Good luck!